Hi everyone, my name's Nicole from the Physio Crew, and I wanted to share with you 10 years of experience as a physiotherapist and helping people reduce back pain. 80% of the population will experience back pain at some point in their life. Only 1% of those will be something serious or sinister in nature. What I see in clinic time and time again is people losing years, months of their lives where they're not able to do the things that they love. Trying to put their shoes and socks on becomes a daily challenge. Trying to be the ultimate dad or mum becomes completely impossible because people are so worried about someone coming over to hug them because it may cause that sharp pain that we're trying to avoid. It can affect every aspect of our life. We may miss that promotion because we can't concentrate at work or even sit for half an hour at a time. We may find that we're actually avoiding social situations with our friends, and for a lot of us it can be a complete loss of identity, and people can actually get as low as having suicidal thoughts. Does any of that sound familiar to you? Those feelings of isolation, that feeling of not being able to do the activities that you love, and that feeling that actually, is this ever going to go? Well, as a physio, I'm fortunate enough to work with people and see the road to recovery, but I also see lots of second opinions for people who have tried everything. They've tried osteo, chiropractic, physio, massage therapy, sports therapy, and things have not got better. And over this period of time, from treating elite athletes, I've treated England athletes, all the way to people who have degenerative change, osteoarthritis, to the normal lay people who may get a muscle spasm and not be able to work because they're a builder or they've strained their back in the garden. After looking at all of those different people, there are some key things that stop people from being able to recover, and this can lead to long-term pain. Now, I believe that nobody deserves to be in pain, particularly when we know with back pain there are some really simple strategies, and education is so important in understanding how the brain works and then applying the right exercise and the right treatment at the right time to get the ultimate result. One of my patients came in after 7 years of pain. He'd been unable to work. He was a carpenter. He was unable to work for 7 years. We had one treatment together where I didn't touch him at all. We talked, we did education, I explained to him everything that I'm going to explain to you in this course, and he was able to go back, and he's a cage fighter now. I mean, you've got to always worry about people who are cage fighters, but he's gone back to work, and it's those kind of cases that are inspiring because I know I can help so many more people. Now, just because of the current situation, it doesn't mean that back pain goes away. So I was thinking about creative ways that I could help people, and the course seemed the obvious thing to do. Now, there's lots of modules within the course. We talk about pain science, we talk about anatomy of the spine, we talk about all of the different things that can cause pain in the spine and how that's transmitted to the brain. We look at what things can people change, what ways can they position themselves to get more comfort and pain relief. We talk about how pain relief works in different ways on the brain and the tissue, and what you should do to try and maximise the response of that and get the most out of the pain relief if you're taking it. We look at non-pharmacological options as well. So we look at TENS, we look at acupuncture. We also go into depth on exercises. The exercise section of the course, we actually will only allow you to go through with that if you have a virtual consultation with us. This is free, included in the course price, but we have to make sure that it's appropriate for you to do those exercises or the further treatments. So we have to make sure that you do that before that part of the course will be unlocked. We've got 7 or 8 other modules that you can just go through and do at your leisure time, which gives you lots of helpful practical techniques, and then you get the second part with the exercises once you've had your virtual consultation. We also go through frequently asked questions. So, is it normal to get tingling? When do I need to be worried about my back? When do I need an MRI? All of these things that people want answered by a professional, not by their mate down the road who doesn't know what they're talking about, but by somebody who is actually medically trained, is chartered, and can give you accurate information. So I really hope that you will join us in this course. Book in your virtual consultation, click the link below, and you can go through and pay. We have got an option if you wanted to do a little bit more, then you can click on the order form to do that too. Have a great day, guys.